Uh, here-
Sorry.
Hi, everyone. My name is Shannon Ryan. I am, among like many hats I wear, I'm a researcher. I work in understanding ADHD and how it works in schools for kids in middle school and elementary school. I'm a psychologist, so I spend my days talking to kids and families about ADHD and the rich complexity of personality and traits that it brings. I'm a mom to a kiddo with a lot of moods and behaviors myself. And so I always walk into my care with families carrying that presence and awareness that all of this is hard, right? That we're carrying space for our friends and family and for our caregiver, for our kids we care for. And we're trying to manage a lot, sometimes which can express itself in the behavioral and the emotional dysregulation side. So, when I was chatting with my colleagues here at CHADD, we were saying, hey, what about talking a little bit more about why? Why do these things present themselves? And why are kids with ADHD more likely to have a diagnosis of a comorbid mood or behavioral disorder? So in one presentation, right, I can't give a thorough overview of every disorder. That's why I think we can individuate and differentiate a little bit today in our discussion as follow-up. But, talking broadly, there are principles around behavior and emotions that we know apply based on how ADHD affects the brain and based on how kids grow up with ADHD. So if there's anything I can do to help further your understanding broadly of emotions and behavior, that's my goal tonight. And I hope we can, and I think we'll have a good and rich discussion. Okay. So I am a psychologist here at CHOP. I'm in the Division of Child and Adolescent Psychiatry and Behavioral Sciences. I work specifically in the behavioral regulation section. So we work with all kiddos with behavior and emotional disorders, behavioral and ADHD type disorders. So I was just telling the team that right up until now, I was having like my favorite night of the week. Oh my gosh, which is that I get to spend Thursday evenings with 12-year-olds with preteens with ADHD. We run a group related to executive functioning. Oh my gosh, we just had a party to celebrate our last day. So it was a very caffeinated, very like junk food sugared up room. So you're seeing a lot of smiling because I'm on riding the high of seeing all my friends. Okay, let me share screen, but the challenge with that, of course, is that then I can't see you. So I know we have the chat, we have our rules, but you guys, I'm really hands-on, right? I would love as much interaction as possible, especially with a smaller room. So know that here in the next hour, I'm here, I'm available for you. So if you have questions, please feel free to interrupt. I don't like talking to my own face, so I'll check in periodically. Okay.
So before you start to share the screen, I did want to tell you there were 3 things that people had put in their comments when they RSVP'd,
Mhm.
that they would like you to discuss. So just kind of to keep in the back of your mind. One was managing autism and ADHD in teen boys, as far as regression of ability or willingness to do tasks, chores, wash your hair, brush your teeth, impulse control, and stealing trivial items. And then another one was a 15-year-old boy with ADHD and oppositional behaviors, refusing to go to school, being raised by a single senior mom. And then we have ADHD, anxiety, ODD combination. So those were things people specifically asked about.
Awesome. Okay. Thank you so much, Angela. Pull up my PowerPoint. One sec, guys. I'm just moving 1 second. I've got all these different things that popped up on my screen. Okay. So in order to understand the role of emotions and behavior with ADHD, we're going to tackle 3 things tonight, okay, in our talks on emotions and behavior. We're going to understand how in the brain ADHD is linked with behavioral and emotional dysfunction. We're going to discuss and review any possible comorbid disorders or diagnoses that commonly accompany ADHD. That's one of my plans to talk about tonight for you guys. And then the last thing, and this is more of a discussion topic than me reviewing a slide. I would love to review and talk from my experience as a psychologist about possible treatment pathways and ways to seek care for these areas. Now, know that here, I'm not your assigned physician, right? And so everything we're doing here is, here we go, thank you. So everything we're doing here is for more from an advisory, right? From more of an information sharing perspective. But I'm happy to answer any questions, and Angela will let me know as they pop up. So we know what this is, but I did want to start with what I do day in and day out, which is talking a little bit about what ADHD is and how it works to understand why other disorders are so common. My good friend and mentor always says, like, we all say about ADHD is that whenever there's a diagnosis, there's usually a little friend that comes along too. But the way to understand that is to talk about what ADHD is and how it works, okay? So we all know this, but ADHD is a neurodevelopmental disorder that is diagnosed in children and adults, and actually is fairly prevalent. So up to, around 11% of kids today have an ADHD diagnosis. It's gone up over time. We know that it's getting a little more prevalent. The reasons why we see this is that tools have gotten more efficient and more effective at picking it up, and we've gotten better at picking up some of the kids we used to miss in our diagnosis. But usually, you can expect in a crowd about 1 out of 10 kids is going to have an ADHD diagnosis. And now, by the way, my explicit bias here as a child psychologist is that I tend to refer to children and adolescents in my discussion, right? I know that as an organization, CHADD works with people across a variety of ages. If you have questions for me within my expertise, I will answer them across ages, but I just will address and acknowledge that, like, I do speak around kids and adolescents because it's my role here at CHOP in the Center for ADHD. ADHD traditionally has always been diagnosed more in boys than in girls. I don't know if any of you have observed that or have an idea as to why, but some of what we see in the ADHD Center is just that the behaviors that are the most interfering, that are the most intrusive for other people, tend to be hyperactive behaviors. And sometimes young girls with inattention show those behaviors in a less intrusive manner. They tend to show them more internally. So the people that get picked up and noticed are the ones that are making the fuss, like making all that hard to ignore behaviors, like picture a little kiddo running like an airplane in the classroom, or picture the kiddo who can't stay seated, right? It's not that ADHD doesn't affect girls. It's that the common pathway we thought of traditionally for an ADHD diagnosis involved easy to see externalizing symptoms, which is the common male presentation, okay? So now we know that many times girls have ADHD, and especially a common diagnostic presentation that I encounter very often is girls with ADHD and anxiety. So what tends to happen is that sometimes as kids are developing and growing older, they have a hard time with these tasks of daily living that we know can be so hard and challenging. So getting ready in the morning, remembering their homework, remembering their lunch, staying quiet in class, like they're the chatty Cathys, and what happens is that sometimes the constant reminders or feedback cause kids to develop an anxious presentation to help accommodate for some of the underlying deficits related to ADHD that are a function of their neurodevelopmental presentation. Okay, so we know that sometimes for girls, a common presentation that we see is a comorbid anxiety disorder diagnosis. And I'll talk about this a little bit later, but an interesting thing about anxiety is that anxiety is an activator in the brain. It's a motivator. So when anxiety kicks in, especially at a low level, there's often more blood flow to the brain. There's facilitated attention. Kids the adrenaline's going, so they're actually quite focused. And what ends up happening sometimes is that anxiety corrects for the ADHD that we might see. So anxiety at a high level is very impairing, but sometimes when our kids have an anxiety disorder and they have ADHD, because the anxiety is present in performance-based contexts, like a classroom, when they're around their teacher, they're trying really hard, sometimes it's harder to pick up or notice. And for this reason, we as physicians and psychologists understand that kids who have anxiety also may be compensating for their ADHD in some ways, and it may not be as easy to pick up or see by an external person, but you at home can see quite a lot of the dysregulation that goes along with it. Generally though, when I think of what is ADHD, Angela, do you need me? I see you smiling.
No, you just we're not even all the way in, and that just blew my mind.
Good, I'm done. I'm out of here.
Keep going, and I'm like, yeah, that, oh my goodness. Okay.
So here's what I think of ADHD, guys. It's like we hear all these things, we hear about all the symptoms, 6 out of 9 symptoms that need to be clinically significant. But like I truly just think this is a disorder of a disorder of management of attention, right? So around you have the small kid who is taking in stimuli and taking in input, and they're doing their best to make decisions and process it the way anyone else would. But they have a deficit in their ability to take in information, understand it, and process it in a timely manner. And this is the underlying reason this challenge with retaining and noticing things around them is the reason why then they can have challenges with impulsivity and self-regulation. Because difficulty noticing or observing things often leads you to not notice or observe your own behavior. So you tend to think before you act, or you tend to act before you think. And it also means that sometimes the things that would slow us down, like someone else's look or expression or noticing social cues, are not registered by the time we've acted or done things. So thinking of it as a disorder of input, right? We're not noticing or picking up, and then also a disorder of output, and that the brain is inefficient in relaying messages down to our muscles, right? We're inefficient in executing what we need to do. So not only are we not noticing what we need to notice, when our brain does tell us to do something, it's an underpowered, it's like a car with no gas in it. It's underpowered. And so we can't control our body. We can't inhibit. And a lot of times restless, ongoing movements and activity is the result. The good thing is that like for many things, right, we have good treatments for ADHD because like you put a gas in a car, well, if you supply dopamine to the brain, it often gets a lot better. So, but generally, I think of ADHD as being this challenge around attention that also facilitates self-regulation. I see them as being linked. Okay, so it's the inability to notice and take things in that also leads to your inability to notice and self-regulate your own body. Because there are 3 types of ADHD, and one of them is the hyperactive subtype. We rarely see it, to be honest. Usually, a child has the combined subtype, which is a combination of hyperactive and inattention presentation, okay? And the reason why is because usually if kids have challenges with self-regulation, they're also gonna have challenges with attention. It's just that sometimes it's harder to see, or we're not really saying there's impairment, but usually we see both. We expect to see both. And the inattentive presentation is another one that can present differently for gender, right? And so the inattentive presentation of ADHD is what one of the ADHD researchers, Russ Barkley, termed almost like a sluggish cognitive tempo. So it's this idea that you just move more slowly. You just need more processing time. And sometimes just getting activated or moving through your days is really challenging and hard to do. So inattentive ADHD refers to just difficulty noticing and remembering, managing your tasks of your day, right? Forgetting things, not writing things down, not turning in homework. Hyperactivity refers to a lot of the body movements, intrusion, right? A lot of the activity that happens in our bodies. And hyperactivity in girls, we know looks a little different than it does in boys. So hyperactivity in girls commonly looks like talking a lot, interrupting. The kid who's always raising her hand in class and like on the edge of her seat, like raising her hand, like, teacher, can't call me. That's actually hyperactivity. What it is it's trying to be channeled through social norms, right? That doesn't mean it's not hyperactive. It means that the student's trying really, really hard within the base of their self-control to like wait their turn, but they're still not. They're still like raising their hand and calling out. But we usually see more talkativeness with girls. We usually see more of the running, eloping with boys. And for everybody, these symptoms start to go away as they get older. So for everyone, the core hyperactivity, the hyperactive symptoms get away as they get older. So for everyone, like the core, I can't sit still. We see that in preschoolers. We see it in our first graders. That's why diagnosis is so key by age 7, because we tend to see it. But for a lot of kids, that part gets a little better, right? We don't really see a lot of 6th graders who can't sit in their seat anymore. But we see that the inattention piece tends to crop up more later in the developmental cycle. So inattention is much more common and prevalent as kids reach middle school, and which is why we just have an organizational skills group with my clients. Okay. When we talk about symptoms, just a couple things, right? So it's really important that symptoms both be severe enough to provide impairment in order to receive a diagnosis. There should be significant disruption in one or more settings in order for us to diagnose. And symptoms should occur in more than one setting, like in home or school, or in a session with me, or in aftercare, or on the bus. And the reason I bring this up is that we all have some component of emotion dysregulation, behavioral dysregulation, ADHD. It's what we want to see is symptoms are occurring often. There's an impairment due to these symptoms, and that impairment occurs across settings, right? That's one of the things we look at for a differential diagnosis. So knowing now what we know about what ADHD is, I want to talk about where we see impairment for the ADHD child, okay? And this is not speaking necessarily about a diagnosis or a disorder, but I think it's really important to acknowledge that for all kids with ADHD, it's very common to have challenges in these domains, and we see them as being so prevalent and so common, we can almost kind of predict what the areas are. Many children with ADHD have sensory needs, right? They have challenges with tolerating noise, fabrics, they have challenges with certain foods, bath time, many things. We know that's an area of impairment that's really common and that we often support. Many kids with ADHD have challenges with learning, and that's intentionally meant vague, but it can happen many times across the academic cycle, okay? So my little friends with ADHD, it can present with doing sustained tasks on busy work is where it's challenging. For some kids, paying attention in a large group class can mean that they're missing instruction, and then they have trouble with learning, and they have gaps in instruction. For some kids, completing homework and turning things in is where it's really hard. And I always struggle when I have a client who has challenges with turning things in. They've been doing the work, but it doesn't get turned in. I get that a lot, right? Many kids with OT especially have problems with writing, and some of the areas we see that are there's an overlap that are sort of developmentally that are sort of linked, or is that many kids have more OT support with ADHD, right? So sometimes pencil, handwriting, curving a pencil, and the execution, like the focus and execution of a writing task can be especially challenging. This one's really important, I think, is that we see a lot of relationship dysregulation and a lot of interference with sibling and family dynamics when a child has ADHD. And the reason often is because of the nature of how ADHD presents in the brain and the behavioral and emotional regulation I'll present in just a little bit, okay? It can be really hard to have a family member with ADHD. A lot of gifts, a lot of creativity, a lot of joy, a lot of passion, right? And then also there can be challenges. There can be more emotional meltdowns and more need for reassurance and coping. Kids with ADHD often describe that they have emotional dysregulation, that they feel emotions really strongly. We also know that peer interactions can be challenging. Now, I mean this both at a young age and at a slightly older age. It looks a little different though. Kids are like first grade. Sometimes, they're running up to their friends. They're not really noticing that they're talking over someone or they're not waiting turns. But when kids get a little older, social skills get a lot more complex, right? And so suddenly some of these pieces all start to interact and build together. So behavioral dysregulation, like having a hard time monitoring your own behaviors, and emotional dysregulation, like having strong mood symptoms, like those things can affect peer interactions, because if you have a hard time regulating yourself or a hard time managing yourself throughout adolescence, those things affect your peer relationships, as well as just the common things, like I might zone out or I might not remember what we were talking about. And so for that reason, peer interactions can look different across time, across ages. One thing I hear about from every single family I work with, like truly every family, is that getting routines done, like activities of daily living, is so hard. And by that, I mean like, okay, it's 7 a.m. It's time to get up for school. Okay, and then time to get dressed. Did you get dressed? Okay, now you have to get dressed. Get out of bed, please. Okay, now let's go downstairs and brush your teeth. Okay, you got to brush your teeth. I already remind you got to brush your teeth. Now put on your shoes, right? So the morning routines are really hard with ADHD across ages. Parents describe kids are late to school, they miss the bus, they don't pack their stuff, parents are driving sports uniforms to school. And so these are one of the areas of impairment that we really see across childhood and adolescence. The other big one of the biggest, like the biggest, is like homework problems. Kids with ADHD really struggle to self-monitor, execute, and complete their homework. Especially, they often need close supervision to do so. So that's part of that challenge at home, that stress at home, right, is it puts a lot of effort and energy on the caregiver to monitor and facilitate that homework is completed. I'm sure many people here, whether or not you have to tell me or not, have had the experience of it being like 10 p.m. the night before and hearing, oh, something's due the next day they had no idea about, or having the delight of looking at your report card and realizing that assignments just weren't turned in. Like literally they're put on Schoology, but no one pressed submit, or learning that like, there's a whole series of missing grades and that your kiddo didn't mean any ill intent. They just like literally didn't notice to tell you about it. Right. So homework is really hard with ADHD and it's a major area of support. And kids with ADHD sometimes have challenges engaging in leisure activities, keeping focus on a task. And a lot of times we see kids start new things, like they're so passionate. They're like, oh my gosh, I'm going to create this new business, or I'm going to like become a cook, or I'm going to learn this new skill. And then they do it one time. They don't necessarily execute it or follow through. Sometimes they have the best, biggest ideas, but they don't necessarily come to fruition. Those are my kiddos that I work with.
There's a question in the
Yeah.
chat. So what are other strategies for body doubling?
I don't know that I have any good strategies right offhand for body doubling. Do you want to share with me more about what you are thinking, if you don't mind elaborating?
So
Sure. Oh, sorry. So I was thinking, hi, so I have a middle
Hi.
schooler and when you were talking about getting schoolwork done and it resonated with me. So having a hard time initiating the task, especially when it's homework we really don't want to do. But I found that if there is like a tutor or someone to sit with her, that she does better. But the tutor has kind of lost interest in coming because
Oh no.
my daughter doesn't really need help with the work. She
Yeah,
just won't do it unless someone's sitting with her, but she also does not want her parents to sit with her.
I hear you. I hear you. Do you need does she need prompts to pay attention? Does she need kind of like, hey, so your break's gonna be in 10 minutes, work to this page, or she just really just focus better with someone else in the room?
I think she focuses better with someone else in the room. I also would love to just understand better her. One of the other things that I've noticed is that, like, she tells me that she can only focus if she has music playing, which I really don't understand how she's studying or getting her work done with music, especially if it
Yeah.
has words. Like those types of
So that one
things.
I can talk. Yeah, 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 yeah. Go
I'm
ahead.
just trying to get to a good rhythm with figuring out how to help her get through her afternoon and get schoolwork done in the most efficient way, recognizing that she does do better if someone's with her. If the teachers all comment that if they come over, she does great, but as soon as they walk away, she's not doing it. And so I just wondered if there are other strategies to help her
Yeah.
like feel whatever body doubling does for her, whatever it does. I wonder if there's some other artificial way
It's
to
super
mimic
cool.
that.
Yeah. It's a super cool. And so here's what I know is that many kids benefit from increased supervision with ADHD. I would say it's almost like a 1-to-1 ratio. Because of the nature of there's a grounding component to anxiety, but also because of the facilitated attention that comes from somebody else being there to help sort of be a source of accountability. Actually, one of the major kind of themes we talk about in ADHD treatment is this idea of accountability, having rewards, having structure, and someone to check in with on these rewards. So without knowing your daughter or or the case, my first thought is structure and accountability are really important. And having sort of the reassurance of someone present is really important for many kids. And now, as to whether or not I can't really speak to whether or not it's needed to have someone there during the entirety of homework. But I do know that almost every parent I work with has some component of checking in, facilitating some kind of, at this point, I'm looking and seeing what's being done to help keep their kids on track. And so I think if it's working, then that's okay. And that works for her. But there's also could be ways creatively as a family to facilitate tracking or communicating about how work's being completed that could also meet that goal of accountability, right? It could also meet that goal of like, hey, you're not alone on this. We have people around who can help. And if you're falling behind, we can help keep you on track. So I think that there are probably replacement strategies around having like a tracking system, or even just having a communication timeline, times that you can check in with each other. Okay, we're going to check in at this time and see where you are on your homework, time management strategies. I'm going to work for this long, and then sort of set goals for myself. I want to be done with this much at this time, and make a planning sheet and indicate where you are with those strategies. There's no like one size fits all, but it does make a lot of sense to me that the physical presence of another person is helpful. It tracks a lot with why one-on-one aids are so helpful in schools for kids with ADHD in the classroom.
Thank you.
Yeah. So anything else, Angela? Are we good? We're good.
I think we're good.
I mean, so overall, guys, I think the takeaway from those slides is really that ADHD is just fundamentally linked with self-regulation. And as a disorder, this idea of self-regulation and attention and hyperactivity is really core to what it is. Those behaviors tend to occur whether or not we are wanting them to. So telling a kid not to be inattentive doesn't really help, right? There's just challenges with input. The brain has a hard time keeping control of what it is it wants, of what it is it's being asked to do. And so for that reason, we can expect that anything that the body does that requires control will also be impaired and affected. And some of the two main areas for that we see are behaviors and emotions, right? So attention and completing tasks is what we see most academically and in the home setting. And when kids are little, we're like, oh, did they take a shower that morning? But it makes really good sense that a kid who is unable to regulate their attention or pay attention to things or regulate their body would also have trouble regulating their anger and regulating their mood. Okay, so that's kind of what we're going to now move into talking about. There's so many things out there that we know about ADHD in the brain. Okay, the most important one that I work with on families is not rocket science. It's not super complicated, but the guiding and managing center of our brain is within the prefrontal cortex. This is like kind of in the frontal lobe. It's the part of our brain that tells us what to do, when to do it. It tells us how to have self-control. It's what tells us like not to go get dessert, but to eat dinner. It tells us how to inhibit one thing and do the other. Okay. Everybody and everyone, the frontal lobe is developing. Okay. It's not fully developed at birth. None of us have perfect self-control. You don't see an infant know how to regulate and tell and decide what it is they're doing. It develops over time. So all of my friends with ADHD are constantly developing their self-control, that they're developing that part of their brain, but it's underdeveloped relative to their peers. So it's a little bit harder for them to learn the skills and to do it on their own, which means they're great candidates for help and support with it. So that frontal lobe is one part we know. The frontal lobe is underdeveloped. They have a harder time with self-control and goal-oriented behaviors, okay? They also, in the frontal lobe, it's emotional control is a component. So not only paying attention, but controlling emotions. So, and with an underdeveloped prefrontal cortex, we're also going to see challenges with motivation, with memory, and with emotional control. In addition, many studies have shown that the amygdala, which is the emotional center of the brain, is overactive. That it's showing that it's lighting up and it's just much more active in kids with ADHD than in a control. All of which shows there's a lot of emotional activity happening and that the main emotional control area is somewhat impaired. It's developing, it's there. It responds really well to treatment, but it's harder for that kid. They're working with less self-control from neurologically. Now, I want to talk a little bit about this idea of the central executive, because in ADHD, sort of the first thing you'll hear anyone say is executive functioning. And I feel like if I was to ask you to raise your hand, you would tell me that you've heard this term and this is really central to what it is you do. But it's this developing skill that we have that essentially we are constantly trying to develop control over our behaviors, our emotion, and our thoughts. So it grows over time, but it's what tells us how to plan, how to organize, how to initiate one thing but not the other. It's what tells us how to inhibit something that would get us in trouble and show self-control. And it's something that tells us how to regulate, right? And how to manage when something feels overwhelming. So as you can imagine, every term I just used is strongly linked with behavioral disorders, like oppositional defiant disorder, like conduct disorder, or a disruptive mood dysregulation disorder, or they're linked with emotional disorders like anxiety, right? One of the first things you'll hear when someone describes an anxiety diagnosis is this idea of overactive anxiety, right? Difficult to control worry. When we talk about behaviors, we're talking about anger that is out of scope. It's anger that feels uncontrollable or hard to manage. So I want to connect for you guys this idea that if a central executive, if this executive functioning portion of the brain isn't effectively managing like output, like if it's just not making the muscles do what it wants them to do, it's also not controlling emotions or anger very well. Anger, especially being what we see in like our oppositional defiant disorder diagnosis. In fact, there are really good researchers that I respect. Some of them, ones that I've encountered over at NYU, where they do a lot of research in ADHD, and some of them here at CHOP that will go so far as to say that an oppositional defiant disorder is really the expression of ADHD emotionally. It's almost the same. It's like, this is the same origin. It's almost the same disorder. Okay. Now that's a school of thought. That's one frame of mind. But this idea that kids with ADHD are going to have an emotional side to their ADHD too is a very accepted idea among the ADHD field. Okay. So yes, ADHD causes strong feelings, and we know this, and we live it every day. And for many of our kids who have ADHD, what it does is result in a comorbid diagnosis. In fact, it's more common with ADHD to have comorbidity and another diagnosis than not to. Now, an aspect that we're not going to go into as much today is the role of dopamine in ADHD. And dopamine is like a pleasure-seeking neurotransmitter. We're chronically undersupplied. It's not that there isn't dopamine, it's that we're not picking it up well enough at the synapse. We're just not efficiently using it. And so one of the reasons why stimulant medications work as well as they do is that it helps absorption of dopamine. And so if we are allowing ourselves to use and absorb the supply that's there in the synapse, then our brain is able to communicate more effectively. If we think of that example of the underpowered car, right? The car without gas, sometimes just providing enough of the neurotransmitters needed allows us to function more effectively. And it's sort of like that with ADHD. Kids often pay attention and have more self-control when they have the dopamine they need. But guess what else? So does anyone, if you know about dopamine, it's a pleasure related chemical. And so what other things cause pleasure? Well, fun, things you love, right? Things that taste good, right? Amusement parks, right? Like, so anything that's like sort of thrill or pleasure seeking, which is why my friends with ADHD are often seen as thrill or pleasure seekers. They're searching for stimulation. So because their brain doesn't really work so well without it, it's almost like, okay, if we just don't run, many kids really need fun and excitement and a game and something activating to respond. And that's a little bit also of why kids with ADHD can feel so on and so go, because they often have struggle with modulation, with this idea of moderation. So kids with ADHD feel like a happy middle is really hard to do. I'm either turned off and I'm not paying attention at all, or I'm like on, I'm a little too on. I need to answer this question right now, and I'm so into it. Like, I need to score this goal. And that's why parents say, well, a kid can focus on video games, or they can focus on Roblox. And it's because the things they like are like hyperactivating. They're like very absorbing. Okay, so it's a disorder of undersupply and oversupply, right? Dopamine works well on the things that are pleasurable. It's undersupplied on the things that are boring. And we commonly see that parents are like, where's the happy middle? Like, where's moderation for my kid? But again, that really makes sense if we think about an emotional and behavioral comorbidity, right? This idea that I'm jumping to extremes can create real challenges and can really create, I think, social challenges. It can make it hard in the classroom. Kids can feel low self-esteem because of the intensity of their experience. Sometimes things are very hard for them, and sometimes they're so on and so excited, other people don't understand why. Okay. Any questions so far? I'm going to pause, Angela, for you. So I think if there is any.
Well, there was just a comment about the music, because
Oh, yes, I'm so excited. And I forgot. I glitched.
I figured you forgot.
Oh my
But
gosh. So music
comment
does
about
help. music helps. Okay. So, it's so funny though, not for everybody. It's like, we wish it was simple, but no, so if a kid tells you music helps, it actually probably does, but supervise and see. So music has been shown to facilitate attention. And there are a lot of people that tell us qualitatively, and we see in research that something about a background noise or something that is like, it occupies your brain and keeps you busy so much so that you can then focus on doing the thing you want to do. It's sort of like there's something going on in the background. Usually it's not something highly interesting or absorbing. It might be like a familiar TV show. I'm not recommending your kids watch TV while they do homework, but sometimes like if you as an adult feel like, oh, why is it that I want to play music while I'm doing my taxes? Or that's sometimes why, is because it facilitates attention to have something familiar and routine in the background. We actually do an activity with my kids in the organizational group where we ask them, we like play different noises and we ask them how well they can focus. We have them do worksheets and then we like test their focus by playing like disruptive noises and then music. And we kind of ask them like to build their ideal study plan based on like how, because often kids with ADHD have a lot of noise in the background. They are around people all the time. They're talkative. So we want them to understand that noise is not all equal. Music might help, but chatter, being in a busy space, having other people at your desk might not help. But yes, I actually do see that clinically. And I think it's worth validating your kid. Oh, it sounds like you are learning what works for you with your performance. You're a good astute observer of yourself. Good for you. But let's see if it gets in the way. Like how much is it helpful? Are you really working harder when it's
My daughter definitely
yeah.
seems to,
Oh my
or at least she always says she needs music. I always thought that it can't be possible. But okay, I guess I'm wrong.
Well, no, but not for every kid. And it depends on the music and not all the time. I wouldn't say that there's one type of way of being, nor is it, I think kids change quite often too. And one thing is that sometimes my friends with ADHD are really good at like testing and figuring out ways to get out of things that are aversive. So music can become an escape too. So it's like, yes, and is my answer. Like, yes, it can help. And we're all people trying to figure out ways to avoid the stuff we don't want to do. And we all get distracted. And some days our attention's better. So it's sort of like a cautious yes. Like, yes, but see if, as mom, if you agree.
Okay.
So we already chatted a little bit about the central executive. I'm going to go right here to this, one of my favorite principles that we talk about. And I think it makes so much sense. So executive functioning is this idea that we're doing goal-oriented behaviors. It's this idea that we're planning, executing, and inhibiting or executing things we need to do. We're organizing. So it refers to our memory, our ability to retain information. It refers to our ability to self-monitor, like to notice, did I get this done? To notice if I turned it in. Our underpowered kids who are not paying attention, like they're struggling in that moment, they don't have dopamine, they cannot really self-monitor if they did something. So sometimes you ask them like, but did you turn it in? They might not know. And that working memory piece, the forgetfulness and then the self-monitoring is really real. Kids, when they don't have well-powered executive functioning, they might have trouble planning and prioritizing, initiating tasks, like starting something. How many times have you heard a kid with ADHD say, I just can't get started? If I get started, it's easier, but it's getting started is impossible. I get stuck. Organizing themselves. Sometimes this is linked with working memory. There are a lot of kids I see that will tell me, sometimes I don't put things away because I need to see it. I'll like forget where I put it if it's not like a dedicated spot. Or sometimes kids are so tired from a long day of self-control at school that they just put things down right when they get in, or they don't write things down because they're pretty done at the end of the day. They're just really tired and spent from the self-control needed. But impulse control and emotional control are both parts of what that executive functioning part of the brain does, right? And I put our little picture of inside out in here because our emotions are closely tied to our executive functioning, to our control center. We interact with it all the time. So guys, getting into a little bit of the theory behind this. Everybody with ADHD has challenges when their brain is cold, like with cold executive functioning. And it refers to this idea that when our brain has not been warmed up, when things are boring, or when things are just not really that exciting, it's like, oh my gosh, can you fold your laundry? Or, oh, can you do this worksheet? Like a lot of kids have trouble getting started with ADHD. They sort of feel like that is not interesting. I don't want to do it. And And this is what we call like almost like a cognitive challenge. The brain is not warmed up, and that's why it's hard. And kids say it's boring and don't want to do it. They can't pay attention. This is like a traditional way we think of ADHD. Kids are just unable to get started on boring stuff. But one thing we now know in the last 20 years of research is that ADHD is all about hot executive functioning challenges too. So not only when things are boring, when you're calm, do you have trouble with regulation? You guys, oh my gosh, ADHD is a disorder of mood dysregulation. It just is. ADHD leads to what we call hot executive functioning challenges too. So sort of like this idea that when the oven is cold, you can't get it to turn on or do any work or do anything. ADHD kids have ovens that get too hot. They are just really hard to moderate and control. And so many kids with ADHD describe feeling like intensely all the time. They say that once they feel a feeling, that feeling is at 100. It's hard to slow down. They say that they're surprised by their feelings too. How many times have you heard that? Like, I don't know why I got so upset. They're caught off guard and they have a harder time stopping the feeling. So it refers to a pathway that's like steeper. So all of a sudden they go from 0 to 60, and then they're at that level longer, and they have lack of insight as to why. And I guess what I'm positing to all you guys is this is all part of that same network of poor emotional control, poor executive functioning, right? It's we don't notice how we're feeling. So triggers might be occurring, but we're not noticing or controlling when triggers are happening. When we're overwhelmed, we have a harder time inhibiting challenging behavior. We might be more impulsive. So we engage in like a negative reaction, like an anger-based reaction. And then the consequences from that can lead to further emotional challenges. So we're not living in a vacuum, right? If you're a kid who, when they get mad, they yell, oh my gosh, I'm so mad, I don't know, I'm so mad, I'm going to blow up the school. Then what happens is that has negative consequences, like really significant negative social and emotional consequences. And then that then causes emotional dysregulation. So these things aren't in a vacuum away from each other. Having an intense reaction to things, emotional intensity, can sometimes be a risk factor for developing other disorders, because that intensity can create negative experiences and create risk factors and stressors, right? Kids with ADHD are commonly seen as more sensitive. I can't tell you how many times parents have described that even from a little age, like toddlers tantruming, their kids have just been sensitive. We mentioned the sensory sensitivity piece earlier, but my friends feel things more. They pick up on things. They're incredibly empathetic. They notice ills with the world, like deep challenges with the world, and they're really good at observing and noticing what other people need and are compassionate. But it also does mean that smaller things lead to more dysregulation, right? So a kid who is less aware and less attuned to, I don't know, social justice, world peace, right? The environment, climate change, they might be less upset by things that are going on. And that sensitivity is a strength and also an area they're going to have to learn to control and use to their benefit, right? Being sensitive is a wonderful thing, but it can lead to more emotional dysregulation. Kids with ADHD are much more explosive. They feel things with smaller triggers, and then they have a hard time controlling it once it hits like max. And once they're already upset, we see this in research, kids have a harder time coping with it. So asking them to do something to control it or calm down or do something to repair it with you as a parent is going to be harder for a kid with ADHD than for a kid without it. Actually, I mean, 40% of kids with ADHD have what we call intense emotional lability. It's 10 times the rate in the general population. Okay, so emotionality and ADHD kind of go hand in hand. And I haven't even gotten into specific diagnoses yet, but that to me is kind of the crux as to why we see so much of a connection between emotionality, behavior, and ADHD, because there's a predisposition, there's sort of like a setting condition that leads kids to experience their environment intensely. And sometimes over the course of a day, this can create genuinely negative experiences for a kiddo that can, I think, over time, build, right? So I wonder if there are questions or comments just about this idea of emotion regulation. Anyone have any comments for me?
There is a question.
Yeah, do you want me to stop sharing for a minute, Angela, so I can?
Sure.
Whatever.
There's a question just about strategies for, like, as we're talking about the kids' emotions,
Mm-hmm.
the ones who are argumentative, excuse me.
Yeah.
Kids who are argumentative.
Yeah. Well, and this is hard, right, guys? So because I'm not here as like your provider and we don't know your individual situation. So generally speaking, strategies we recommend when kids are argumentative, this is over the treatment we would say for kids with like, behavioral or ADHD disorders. They fall under like one broad category. It's like we sort of say, hey, parent training or knowing how to respond to behaviors to provide structure and refer to positive behaviors, right? Catch what's actually working tends to be the best way to offset argumentativeness. So kids kind of sometimes, ADHD, one of the tricky things about it is that because kids are sort of undersupplied with dopamine and their brains are sort of turned off, they have really, really, really crave attention. It helps motivate them and helps them like get their brains working. The body doubling comment makes me think of that. So for some kids, negative attention is as positive as positive attention. Attention's attention. So arguing and feeling like connected through an argument can be energizing for a kid. It can still be motivating, even though it doesn't necessarily make sense from a logical perspective. We know that your parents stopping everything to be like, stop doing that. Or like, I told you already. That's still like they got attention from it. And so sometimes the ways we recommend coping in the household when we're in an argumentative cycle is to instead sidestep it, like have a limit you establish, hold to your limit, right? And follow through. But sidestep when you can, ignore the small stuff, and then bring it back to a positive dynamic so that we're not constantly burning the fuse when it comes to like the stuff we get in power struggles about. The treatment type for behavioral disorders, both ADHD, behavioral disorders, and even autism spectrum disorder all fall under the category of what we would call parent management training. So this idea that parents and a trained provider can interact, problem solve, and discuss how the environment can be managed and supported for their child, and how they can support school and support home in making their child's experience a positive one. And it's fundamentally designed to increase self-esteem. We're going to protect the relationship, help the child feel better, and focus on what they can do so the motivation is driving them rather than not activated. Okay. That was a long answer, but yeah.
I don't see any other questions in the chat though.
Okay.
Okay, nope. How to help a kid pause before exploding.
Such a good question. Such a good question. And I commonly feel that sometimes it depends where we are in the launch sequence. Like if we're thinking of a rocket about to go up, right? It's like, where are we? Are we like just starting the countdown? Are we like right there at activation? And you got to be mindful I tell parents all the time, it's like picture a roller coaster going up. Like once it's at the top and it's like right there before that big drop, it's going to go down. So we think about where we are on the activation escalation. Okay. If we are, really at the beginning, and we're noticing that's a big part of CBT, you guys, cognitive behavioral therapy. That's a recommended treatment once kids are a little bit older and they have more insight into their feelings and what they can do to stop it. Usually CBT works like 9 and older. Okay. So CBT sort of helps us say, how do I notice I'm starting to get upset sooner so I can do something about it before I'm too far gone and I just have to like let it rage, right? And for our younger kids with lower self-control, it makes good sense that they rage more and like have less insight. Our older kids can use more strategies. So it's developmentally affected. So for an older kid, you can see it starting to get revved up and it's like they're pacing. You see some of their telltale signs, like maybe they're like rolling their eyes or they're on their screens and they're avoiding talking to you. Maybe they're muttering under their breath. What I might do is encourage them to take space. Commonly for kids with ADHD, because there's always that kind of a little bit of a sensory piece, there's just a little bit of overwhelm and flooding that's happening. Like this feeling is so strong right now. I don't even know why I'm upset. So the best thing we can do is time away from consequences, right? So a kid feeling a feeling is not a bad thing. A kid feeling a feeling is a great and a helpful thing. But if we encourage that kid to say, hey, feeling your feelings in a way that you're not going to have a negative consequence on someone else would be really helpful. Like, so is there a space you can go where you can just get it out? No judgment. Do you just need to take 5 minutes? Like, I'm not going to talk to you. Tell me what you need. I don't have to talk to you for 5 minutes and you can just like sort your thoughts out. But time and space is usually super helpful. I have a lot of kids who swear by certain strategies or routines, like being recommended to like drink a cup of cold water can be helpful. The temperature piece, to stepping outside, especially on a day like today, really helps with the temperature change and environmental change. But commonly, and distraction-based strategies can be good. Having a kid just do something else to get their mind off of it for a little bit can really help them re-regulate. But what's going to work for each kid is going to come down to how receptive they are to hearing from you for that minute. And it's come down to their insight onto their emotions and what they need. And so if you're not able to connect with them in that moment and say, okay, we got to solve this, I can see you're heading toward an explosion, then I would just give them space. Like I would say, hey, I love you. I can see you're doing your best right now. I feel like we're heading toward a setback. Let's check in when you're feeling a little better. What can you tell me when you're feeling better and like how long you'll need? And if the kid mutters like, oh, I don't know, then I would just walk out of it, right? Just give them space to save them from themselves and just give them a chance to calm down. When we get to the point where someone's already having a meltdown, and that's kind of one of the core features of like oppositional defiant disorder or autism spectrum disorder. When we get to the point where like activation and the sequence has been launched, we just kind of have to let it ride. You know, when kids are really upset, we call it dino brain. They're just there. Like they're just in their prehistoric mode. They can't talk or reason or do complex things like homework. They're just raging. So in that brain, we don't expect complex thought. We expect them to express it until they're back down again. And that's where, again, space, redirection and encouragements to regulate. But even so, they're going to regulate on their own eventually. All emotions leave eventually. All strong emotions will eventually go away. Remind kids, it's like waves in an ocean. They come in and they always go back out again. So if a kid is feeling overwhelmed, then I would recommend prompting a skill, but giving space. And if it's getting to the point of true, like aggressive, I would just recommend you then consult with a professional who can advise you on like those specific behaviors, because I wouldn't want to step outside of my zone of practice. But there are great care centers around. Among them, there are evaluations here at the center at CHOP, and then there's many other practices in the area that can help evaluate. And here at CHOP, we have a great treatment center that was opened up just this year that does 24-hour kind of check-in. So if you're ever concerned, if there's ever aggression or there's ever anything concerning about your kiddo and you want them seen right away, the Behavioral Health Crisis Center over as part of Penn and CHOP has 24-hour access, and kids can always get seen by a psychiatrist and talk to someone about ways of calming down. Okay. Any questions? Okay. I do wonder, so I have slides, right? But we also are not a large group. And I wonder if anyone here would like to base the rest of this talk, the final half an hour, on specific disorders and understanding a little bit of how to treat or manage those disorders. And I'm super happy to individualize it that way if that would be helpful for the group that's here. I'm here if you guys have questions.
Let me ask the group, do you guys want me to stop recording now, or are you okay with, like, if you want to ask a question, are you okay with it being on the recording? No one's saying anything.
I'm happy to keep doing slides if everyone's more in the passive receptive mode. Sometimes we're also busy with evenings, cleaning up after dinner. If we're more in like in listening, I'm happy to just keep doing slides.
Okay. We're okay with the slides. No one's asking any specific questions.
Okay.
If you do, you can come off the chat. I mean, come off mute.
No problem.
Actually, I do have a question. One of the things you said is you talked a lot about parent coaching.
Yeah.
So one question I have for you, I have participated in some of those. How do we, like as parents, we can like negotiate how to adjust our own behaviors to, I guess, accommodate our children's
Mm-hmm.
kind of emotional dysregulation? I guess the question I have is when do we get to a place where, because like they won't always have the benefit of someone who loves them. managing, I mean, kind of managing themselves for them. So when does it come? I mean, so I do
That's
know
it.
about
You're right.
cognitive behavioral therapy, but I guess when is it best for them to, kind of own more of their own kind of like measurement because like they have to exist in the world?
You're spot on. You're talking about a teen, I'm guessing, right?
Mm-hmm.
Yeah. Yeah. So it's super different. The expectations are so different. What we're doing is we're moving from, hey, your body feels overwhelming. I'm going to help set you up for success to, hey, you now get to make choices and I'm going to help you think through your choices, but you have to have autonomy and learn independence. It's a totally different pathway. You're totally right. So up to like age 9 or so, I say, hey, let's do parent training. Even a little older kid parent training can be great, sort of through primary, even some middle grades to some extent, but I really start involving kids more in their care as they get older. Here's the tricky thing about ADHD, you guys, specifically as a diagnostic disorder. There's really low self-awareness in ADHD. It can be hard for kids to sort of see themselves the way other people see them, especially the younger they are. Luckily, this gets a lot easier and better as kids get older. It's really common to have a kid sort of not see the socially interfering behavior or the mood disruption. It's just the way their brain works, so everyone's must work that way. Kids actually will commonly tell me they don't know they're zoning out until I point out to them what a zone out feels like. And they're like, oh, it's all the time. I didn't know I was daydreaming, right? And I'm like, yeah, that's what that is. And actually, I mean, I've heard adults tell me like, oh, I sort of just always like zone out. And then I'm like, oh, wait, I need to listen again. And they get used to managing it and handling it. But for kids don't realize when their presentation is necessarily different than their peers. And so the younger they are, the more we got to set them up for success. The older they are, the more we can teach them skills. Now, I think, yes. So all of the therapies I would recommend today come with this idea of adolescence and kids doing more work the older they get. Really 12, 13, 14, this is where they can have insight and share. And actually they're the best person to process and discuss what's bothering them and be able to show control. Okay. So yeah, I agree with you. That child-based therapy can be really helpful as kids get older. Now, the thing about ADHD that's really tricky is that talking doesn't really help ADHD very much. It's kind of a crazy thing. But if we're talking and saying how you feel about ADHD doesn't necessarily create change. ADHD is really rooted in behavioral therapy. So what the talking component, the idea of my child's going to see a therapist and talk through strategies, tends to be more helpful when it comes to the comorbid disorders, like thinking through, what's the unintended negative consequence if I throw something at my teacher? What's going to happen if I do put graffiti on that wall, right? Or, okay, let's understand why I'm feeling anxious and how I can challenge my anxiety. Those cognitive behavioral therapy strategies are more helpful with behavior and mood. When it comes to things like just the things you're doing without realizing it, often we can still get a lot of benefit from the environment being structured for us, and then helping kids develop self-awareness through pointing it out to them and showing them positive behaviors. The primary component actually of parent coaching, when it's done correctly, isn't so much setting up the environment, which I think is how some parent coaches do it, but a good clinician who does parent management training is really helping the child see their own behavior differently. So for me, it's like, okay, we're a team and we are working on cleaning, on not being so messy. But instead we would say, okay, instead of focusing on the negative, let's focus instead on the positive. Let's work toward the opposite of that behavior. I want to clean up more instead of being like not being messy. And we would say, okay, let's find ways to reinforce it and shape it. So by the time the kid's getting a little older, they've gotten positive feedback. Now, when you have a teenager with ADHD and comorbid, it all gets complex. And so as to what to treat first and how to handle it, I would recommend you seek individual consultation with a care provider. But I do agree though, and I do want to support that, yes, teaching skills and teaching kids how to regulate and use those skills independently is an important part of adolescent care. There's always a balance between how you as their parent point out and shape their behavior and what things we pay attention to or notice. And the younger we are, the more control and say we have as parents. The older we are, the harder it is to influence as parents. It's a long-winded answer, but hopefully that touches some common themes.
There's some questions about anxiety and about also about the difficulty of medicating kids that have multiple diagnoses. So like depression, ADHD, anxiety.
Yeah, so let's see, anxiety. Okay. So I'm gonna save medication discussion for a provider who's a medication expert. And what I will say is that that's just my knowing my lane, right? Knowing my boundary. So especially when it comes to medicating mood disorders. So I always recommend that if your kiddo's had ADHD, you feel there's mood stuff coming up, to just to get a good check-in with your child's primary care doctor is the first place to start. They'll have scales, they'll be able to do a check on all the symptoms coming up, and they can often do a first step in treating and recommending. Okay. Now, in terms of anxiety, and are we saying we want to talk more about like anxiety and treatment types? Is that kind of what the prompt was for the anxiety question?
Well, there's different questions and they were about maybe.
Okay,
So like
I'm
just
looking here. Yep.
What?
you guys that put that in the chat if you
I don't know if can you hear me?
I can hear you.
Okay, on the anxiety end of it, my granddaughter, she was diagnosed with ADHD and anxiety along with it. She's currently seeing a doctor and they're back and forth on different types of medications. And one seems to bring on the anxiety more than the other. And I'm just wondering how the connection goes in and out.
Well, so this is me. So as a psychologist who is not a medical provider, and I'm hearing ding. So if my computer, if it's low on battery, I might quickly turn off and plug it in because I'm like in a different space than my charger. But okay, so I'm not a medical provider, guys. Okay, so this is me speaking not as the expert, okay, but as someone who consults in ADHD medication, there's some benefit to consulting with a doctor. Because ADHD medication also can be emotionally, it can cause a little bit of change in mood or some emotional lability. Some irritability can cause kids to say they feel more emotional. I always say if you have those concerns, always talk to a physician, right? I'm not an expert on it. What I experience with kids I work with is that the emotional side of ADHD medicine tends to be relatively minor and tends to be easily managed and maintained. If you ever have concerns about mood and anxiety getting worse with medicine, talk to a doctor and see, because there's probably a lot they can do to moderate and understand that. Anxiety and ADHD though in general is kind of interesting and tricky because anxiety, I think, is something that many kids feel. I don't know, you tell me if you see this, you guys, in your families. And sometimes I think kids share with me that anxiety might help their ADHD sometimes, or that anxiety might almost like control for it. And it's like, there's almost like a pathway that happens. I'm going to stop sharing for a sec so I can see you guys. There's almost a pathway that happens where kids will say, hey, I don't have impairment because I can always get it done, even if I procrastinate because the anxiety kicks in. They don't know it's anxiety. It's like their motivation. Well, I can be a AP student. I can be a, you know, in honors and in band and in all of this and have ADHD because even though I'm terribly disorganized, the fear of doing something wrong or just upsetting someone can lead to the control part kicking in eventually. It gets that brain turned on and activated. So we see anxiety and ADHD co-occur a lot, right? And the manifestation of it that we see is kids who are more rigid, they become more upset at small changes in routine, and they're sort of inflexible, like, no, this needs to be this way. That's when they're younger. And when kids are older, there's perfectionism, anger and making mistakes. So some social worries or concerns, especially, and that sometimes at a low level, kids almost feel like anxiety is familiar, or it's in some ways anxiety is like helping them get by. Like, oh, and by the way, often anxiety is what people see, not the ADHD. They'll say, oh, she's anxious, or they'll say, we see that she's worried about this. And sometimes at school, people even say, I don't see anything wrong at all because like she's my most helpful kid. She's like the one that I'm saying she because this is a common female profile, because teachers like, no, but she's the best. She's always next to me and helping. Like she's always there's my favorite student. And parents describe a kid who is like incredibly exhausted by the time they get home from holding it together all day. And they were like hyper vigilant all day, trying to like notice anything the teacher needed and trying to like overcorrect. So ADHD and anxiety is interesting because when a kid is feeling really anxious, ADHD, inattention, research shows that inattention is not as obvious. Like the brain turns on and activates and it controls for the memory lapses. The kids just pay more attention. But then of course, anxiety, when it's really, really impairing, when kids are panicking, when they're really dysregulated, when they're overwhelmed, that is impairing. So that no longer fixes attention. What I tell kids all the time is, we know anxiety and ADHD go together. We know it's like about 50%, right? Have both. Well, or 50% of kids with ADHD also have anxiety. But it doesn't help, like we need to manage it because being stressed or worried is not a great way to get stuff done. And it's not helpful, nor does it produce your best work. When you do it late and you're tired, it impairs relationships at home, it affects your self-esteem. And because you were able to complete it, doesn't mean it was completed like the best or most thorough way it could have been, right? So we try to help kids understand that generalized anxiety, like worrying about stuff, can be helped sometimes by kids becoming more organized and developing systems for their ADHD. Sometimes they go hand in hand. This is not something I know research on. I have clinically experienced with some kids that kids can report more checking behaviors and more concerns about making mistakes and feel sort of that they're in this like loop of like, what if I make mistakes? What if this goes wrong? And that there's a link between ADHD and OCD in that regard, right? A little bit of like, oh my gosh, I'm so used to getting in trouble for this, or this is so hard for me, that they sort of check and are repeatedly kind of compulsive as regards aspects of their ADHD. Every kid's different, it's complex, but those are some of the pathways and the overlap that I see between the two. Speaking
Can I
broadly,
ask it? I'm
Yeah.
sorry. Can I ask a question? I was one of the people that commented, and for me, this is. I know my child's older; she's 14,
Yeah.
but I am very, very new to the ADHD piece. That was something exactly like you said that was never picked up on. It was always, the focus was always on the severe anxiety and the depression. So
Hey, Marianne, do me a favor, keep talking. I'm going to turn off my camera for a second. I'm going to go get my charger. But
Okay.
I'm here. I'm just grabbing my charger while we're chatting. Okay.
Okay. So treatment is always focused on the mental health issues. I don't even know what treatment for ADHD looks like, or whether that be accommodations in school or at home, or and I guess I just, she's at this current time, she's only in say outpatient therapy once a week. The outpatient therapist is extremely knowledgeable about ADHD. She's actually the one who kind of saw it and got us to look at that way. But how do you balance between helping her with her depression and anxiety and then ADHD treatment, which whatever that is, I don't even know at this age. I'm not even sure if I'm making sense. I guess I don't know where to start. As a parent, I don't know if it's getting addressed in 1 hour of therapy a week.
Yeah, you are so valid in how you're feeling and what you're saying. And it's not just you, it's probably everybody to some extent here who has felt this way. And it's also not, what you're describing is that once you become an adolescent, the pathways are more complicated. ADHD is simpler to treat when kids are younger. So knowing exactly what the right recipe is, it's hard to do. I actually want to validate that if you're seeing an outpatient therapist who understands ADHD, you've probably done more than you think. You probably actually have done a lot. And if that therapist is monitoring and it feels like she's well supported, they're likely guiding care and can give you recommendations around things like school supports or 504 plans. And so if you are receiving care with someone who is competent and doing well, I'm guessing you're actually treating your ADHD actually probably pretty effectively.
I don't know about that. It's more like she was able to notice it, but for example, like accommodations, like say help or suggestions, it's only been like more time to take a test or leaving the room. That's it. And that's that's the only thing that 504 has ever done. And so I just don't know. Yeah. If we are ever addressing everything.
So ADHD, parent training, right? When the kids are growing up, we generally recommend, there's a skills training intervention that is evidence-based. We've done a few trials here at CHADD on, called it organizational skills training. And what it sort of does is teaches kids that executive functioning piece of their brain, like how to inhibit, execute, and manage their stuff. So it's like, how do I manage my materials, pack stuff, know what I'm doing? And, that's the therapy that can work really well for teenagers for ADHD, is sort of like teaching them to manage their routines, the independence they want so much. And it often is offered by a range of people, like executive functioning coaches. There are ADHD coaches, there are therapists that do it, there are psychologists like me. So there's a range of providers that offer sort of skills training when kids are older. Sometimes kids with ADHD also benefit from emotion regulation support in sessions. Like within therapy, they work on coping skills and knowing what my emotions feel for me, how do I know they're coming on, how do I communicate what I need to be able to calm them down. We can't change the feeling, but we can help how we respond to it. So in that way, the kid is in therapy, but we're in many ways working toward the same goal of setting up the environment for success. The kid is one of the drivers, and like, I need to let people know this about me. I need to work to control it and express what's bothering me, because processing what bothers you is still really an important part of emotion.
Yeah, that goes on a lot in therapy for her.
Yep. Yep. And then with school, this is one of the funny parts, is that many times high school is sort of like, oh, what do we do for ADHD? It's over by now. And that's actually really not true. And so I think there's a lot of educating we can do around our high school colleagues and everyone about still supporting ADHD and understanding that kids might still need support. But because kids are so much more independent and there seems so much more together, sometimes I think teachers just think, oh, they're just not trying, or they tend to attribute it to like that kind of dispositional bias, like, oh, it's not really a disorder, they're just not doing it. They see it as laziness. So ADHD, though, what we say at schools is like one of the best places to manage your ADHD. Okay. And anxiety, both of them can benefit from 504 plans in the school setting. Now, I'm not your provider, so this is always something you should run through and consult with your team. But generally speaking, many kiddos who have ADHD benefit from accommodations, and that really is a great way to support ADHD in that setting. And then with the team, you can determine if there's a need for more supports underneath the framework of an IEP. So that really comes down to whether or not the behaviors, emotions, the ADHD is interfering with learning. If there's a learning impact, then sort of sometimes the team can sit down and say, hey, let's do testing and see if we need to do an IEP. An ADHD IEP would sort of go under the other health impaired category. But many times kiddos also have other areas that come up for IEPs because they also carry this mood and this behavior component. And many kiddos, so about the comorbidity rate between ADHD and autism is also about 1 in 2. So many kiddos with ADHD also have an autism diagnosis. Although I think that one, it's the flip of kiddos with autism, 50% have an ADHD diagnosis. I don't think that 50% of kids with ADHD have an autism diagnosis. So the supports in schools are so myriad and so vast, depending on comorbidities or depending on the nature, but you can and should start the conversation with someone at the school regarding what your school normally does for ADHD, provide the medical documentation and say, hey, are there supports and accommodations that are available for my child? And what's the timeline to get them put in place? Okay. Schools often have organizational groups or a counselor that can provide organizational supports. Many families benefit from a therapist for teens, still working on things like activities, daily routines, remembering things, completing their daily tasks, all the boring stuff that is hard to get done. But I agree with you, at that point, the kid does drive more in treatment. So if your sessions are child-led, even though you feel like this is ADHD, I think that's valid and makes good sense, especially here in Pennsylvania, when at 14 and older, kids consent to their own treatment and care, and they have confidentiality permissions.
Okay, thank you.
Sure. So any other areas that would be helpful to take more of a deep dive into as we speak about comorbidity, right? So common comorbid disorders for ADHD include oppositional defiant disorder. That's one of the most common. There's about a 65% overlap. And it's, I think, one of the ones that many of our friends get tagged with without the ADHD being noticed. So I've heard very commonly about kids in schools, especially kids of color in schools, being seen as a behavior problem, as a child who is angry, they use curse words, or they're They are defiant, right? They're intentionally defiant and argumentative. And so these kids who are seen as kind of having challenging behaviors, the ADHD part is often missed and ignored. The truth is that everybody gets mad. Everyone gets mad. Everyone's defiant sometimes and breaks rules. Kids with ADHD just have a harder time slowing down that emotional loop. They feel it and then they act. And the more we can calm the impulsivity that can come up for these kids as they're getting older, we want to slow down the thinking. We want to slow it down so they're thinking of consequences, okay? They're thinking of what to do before they act. Actually, a treatment that I got trained in when I was in my postdoc was really kind of cool because it was teaching kids how to slow down their thinking and think of consequences like before they engaged in misbehavior. So we did a lot of work with kids on perspective taking and understanding that even if you're angry in one situation, someone next to you might see it entirely differently. We all have different perspectives based on where we are. And we did a lot of work on helping kids say, okay, let me like list out the pros and cons of this thing I'm doing. And if I make this decision instead, how would that lead to like different consequences? And that's a great example of how CBT actually can be used to apply to oppositional, to kids who have defiance or behavior challenges. If I take away for you all, I'm not your individual provider, so I can't speak to your individual cases entirely. My takeaway is that behavioral dysregulation, talking back, explosiveness, feeling angry is so common to ADHD is that some people even call it like almost the same disorder. Okay. It's heavily comorbid, 65%. And it's very commonly something that creates the most impairment for kids when they're in school, right? Like, oh my gosh, it's so, but understanding that this kid isn't, there's personal responsibility. There is teaching kids limits and to follow the expectations. And I truly believe from the kids I work with, or working with kids who have shorter fuses and they get more upset than they want to, and they're also upset by how upset they get. Okay. And so that's one of the reasons I think there's this overlap between ADHD and oppositional defiant disorder and other disruptive behavior disorders. Anyone have any questions about ODD?
Well,
About
I just wanted to add to that too.
Yeah.
Just to make sure that, because a lot of times, especially with teenagers, a lot of teachers don't really understand this. We don't get a lot of training about it. Well, we get probably like no training about it, honestly. And I say that as a teacher. So there are some teachers who will trigger your child and will escalate things and not realize they're doing it in the interest of them feeling like they're being disrespected in the classroom. And I've had to have those conversations with certain teachers for my own children. It's like, don't yell at him. Like it's
Yeah.
simple. But
Yeah.
you have to tell them, if you're yelling at him in front of the class, it's going to, and that could probably be any kid, whether they have ODD or not. But there's certain things that they do that trigger a child. So you have to make sure, like sometimes you might come off as the bad guy, but you have to let them know, like you have a role in this as well, as far as helping them to regulate themselves in class. So if you see something, like sometimes you can ignore it or you can pull them to the side, like things like that. So I just want people to be mindful of that and letting teachers know and holding them accountable too.
It's a perfect example of how even at an older age, it's a combination of individual responsibility for the child and emotion regulation, and then also a combination of setting up the environment for success, right? Like we all play a part in knowing how to give kids space, prompt them to use their coping skills. Remember, their brains are still developing, so even our kids that seem full grown and they seem like they're adults, they're still struggling with impulse control. They don't have that central executive fully established at all. And especially teens are so much more prone to risk taking and prone to not thinking things through. And so the more that we can set them up for success by prompting them to use a skill, by having a quiet space, or having even like something as simple as like monitoring the environment so that like not playing like if they're doing homework, like loud music, things that are activating aren't going on. These are all things that help them while that part of their brain is still in development, and allow them to use their skills more. So it's not really an either or of like, are kids responsible for their own behavior or our parents? It's more like the more that we can help facilitate control and set them up for success, the more they can then use the skills they have. Especially if they're newer to treatment. It's sort of like they'll get better at using these skills, but if it's newer and harder to do, sometimes a prompt or a scaffold, it's like we can help them a little more with developing their skill.
Thank you.
You're welcome. Welcome.
And I want to say something. Sometimes for our kids, what adults in general don't understand is that the way that a lot of our kids' brains are, they need context, right? They need context. So when they'll ask questions, when they're younger, they just seem annoying. When you get older, it seems defiant. Where it's like without the context, it doesn't really sometimes give the motivation to get something done. Some of our kids that have like the comorbidity of autism, they need to know all the instructions because the way that their brain works is that certainty makes it easier.
Mhm.
So when other people around them do not give them that, it's really disorienting for them, right? So if you don't know the context, you don't know what you're doing, it's disorienting. So it's hard to start. It's hard to know what you're doing. You probably get yelled at. If you don't know the landscape and no one's telling you, then you don't want to start because you can literally physically feel frozen. A lot of my clients, that's there's a lot of physical things that happen with our kids that we don't even notice. And so when it's a physical response, it's really difficult for someone who's not having it to understand. But when you know about these things, then you can try to help accommodate them and not have them feel bad or called out. Because when you're, especially older, the last thing you want to do as a teen is to be noticed for your difference. And so,
Such a good,
yeah, it's. I know it's so layered. It's just so layered. But these are some things that people never ever. I very rarely hear them talking about. Um, and as you mentioned, sensory issues. Like, I mean, my underneath those, those lights that make the humming noise.
they're kids are often already at a baseline level of like, I'm pretty activated right now just by like engaging with your world, right? Things are a little louder, I'm a little overwhelmed, everyone's in my space, the lights are bright, and then we're already it's easier to go immediately up in emotion dysregulation to go from 0 to 60 because not really at 0. They're kind of like already pretty tense, right? Pretty sensitive. I actually wanted to bring up one more thing, and we're at our time. So I don't know if I can make one final comment, Angela. Is that okay?
Yeah, go ahead.
We mentioned that with anything, with behavioral symptoms like aggression, impulse control, defiance, or with these internalizing symptoms like excessive worry or with like mood, like depression. We haven't really talked about that too much. We talked about how for all of these disorders that we encounter, there's a piece of this that has to do with like difficulty with regulation, and that's part of the ADHD. But there is a piece, I think, of having ADHD that can be challenging for the individual. And Ingrid, it was so great how you just articulated that it prompted me to want to provide a little bit more context. The truth is that having ADHD can be a hard lived experience to have. Having ADHD and autism is autism, the comorbid disorder that refers to preferences to have routines and to have things a certain way, sometimes sameness. Kids are really logical, like just really good, scientific, detail-oriented, logical thinkers. They tend to see things very clearly and very directly and honestly without a lot of the emotional ambiguity some of us have. And they may have challenges finding common interests or sharing things as widely with their peers. So when kiddos have some of these challenges, right, what happens is that sometimes the lived experience of being a person with a neurodevelopmental disorder can be a hard one. And some of why we base some of our strategies and our techniques in positivity has to do with undoing or offsetting some of the negative experience kids are having living with ADHD. And I'll give you an example, and that's if we think about like a kiddo who's 9 or 10 and they are hyperactive, they probably get up that morning and get 20 prompts minimum before they even get to the school bus. And prompts are not corrections. Prompts can just be like reminders, but it can feel a little bit like this. And this is not meant as parents, very, very excellent parents who are doing the best they can still have a hard time managing ADHD and feel like they're in a position of like, I'm a robot. Like I'm just saying the same thing over and over. Right. But sometimes what it can feel like for a kid is like, I'm zoning out, I'm daydreaming, I don't know what's going on. And then all of a sudden you're hearing like, where's your backpack? We're running late. Like you need to get your stuff together. Nothing harmful or critical, but urgent, like a little stressed out. And the kids hearing like, oh, I guess I did something wrong, but I was like off in La La Land, so I don't even know. Like I was like off daydreaming or thinking about whatever. Maybe I was like off like opening Roblox. I don't know. So kids like, oh, whoa, and that's an activating experience. It's like there's an uptick that happens, right? When kids sort of come to realize they did something wrong. What the problem is that what happens is that parents are often the most understanding, and parents are working around the clock to give multiple reminders. They know their kid, but that kid navigating that day is encountering a lot of people who may or may not be as patient. And that feedback is given again and again and again. So kids standing in line, they're 10. Oh my gosh, stand too close to someone because they're zoning out, or because they can't control their body. Maybe they're tapping, but they're next to somebody else. Oh my gosh, don't touch me. You pushed me. Like, you know what I mean? Like constant from a peer. Maybe that kid is like not even realizing that they're like rocking back and forth on their feet. Same thing. Maybe the teacher's like, they learn great, but they can't sit still in their seat. Well, that's in their report card. That's what everyone talks about at the conference, right? And kids hear over and over, wow, there's just something wrong. Like, I just can't do this basic stuff as well as other kids. And part of what I think can be so powerful about treatment for ADHD is this idea of externalization. Like, yeah, you glitch sometimes. Everybody does, even your teachers. We call it like, yeah, you had a glitch. Everyone glitches. Your computer needs to restart. It's a glitch, right? And it's not you. You are doing the best you can. Like you are working hard. The glitches are happening to you and it's not your fault. This idea that your brain is just short circuiting, but it wasn't you. It wasn't intentional. So we try sometimes to help with that cognitive piece of it, of like just letting go of the guilt, like letting go of this idea that I didn't try hard enough, or I was lazy, or I did this on purpose. Because I think that the experience of being a teacher, a peer, a bus driver, babysitter, right? Anyone, is that throughout the day, the acquisition of negative reinforcement can be so high that I'm not surprised that over time, kids acquire more negative self-esteem. They might feel down upon themselves or feel like it's harder for them to do the things that other people can do without trying, right? And so often I find ADHD kids respond well to treatment if we can address that underlying feeling of difference, right? That feeling of like, I feel I'm doing the best I can, but something's wrong with how I'm doing it. Like I don't mean to feel things so strongly. Like I don't mean to not control my body. Sometimes that's a big part of opening up treatment, is like acknowledging the fact that their environment can create a high rate of negative feedback. And the reason why ADHD therapy, the evidence-based therapy, is so focused on positive reinforcement is not because we don't believe in limits or we don't believe in like consequences. It's because we have to counteract the ratio of negativity kids get throughout the day, right? When you're hearing this is wrong, this is wrong, this is wrong, it's really great to like look for what worked and point out like, oh, actually, it's really great that you wrote your name on that and put it in your folder. Good job. Because it's like, and the other thing about praise as a treatment strategy is that when we praise kids with ADHD, it's a little bit like a GPS that tells them what to do next and to do in the future. So because praise, that dopamine burst I mentioned, is so activating, it makes kids pay attention more. If you give direction attached to a praise, kids like ears perk up and they hear it. And then we're sort of giving them like a manual for what to do next. Oh my gosh, okay. My mom likes it when I put my laundry away the first time. Do you know what I mean? Like, it's like, what? Like, okay. So now they've heard it and now they have a better pathway for how to show behavior in the future. Maybe it's put laundry away the fourth time, not the first time. That's my last comment. Sorry for going a little bit over, but I just wanted to make that remark about environment and ADHD, right? Is that the truth is ADHD can be really annoying, can be really hard to manage, right? And if we help kids understand that there are strategies to control it, then they are also struggling with their ADHD. It's not their fault. That can help. Okay.
Thank you so much,
You're
Dr.
welcome.
And thank
Gosh.
you everybody for being on. If you didn't sign in, please click and send the chat. You can sign in. And our next meeting will be on the third Thursday in April. Some of the things that you've been talking about is actually scheduled for next month. So we have Dr. Craig Sidall. He's going to be talking about behavior management for parents, parent coaching, all those different things. So that's next month. So we hope to see everyone again. And again, thank you again. I told you the whole anxiety piece of
That
it.
was so good.
I love it.
It was such a pleasure to get to spend my evening with you guys. Truly, what a lucky me. And so thank you so much for your engagement, for your attention tonight. What a great talk. Thanks, everyone.
Thank you. So everybody have a wonderful evening.
Bye. Thank you so much.
Bye. Thank you.
Thank you.
All right.